Hello and welcome, everybody. We're hosting today's session on behalf of the Western Research Hub for Physical Activity and Health. And this is a part of our ongoing knowledge exchange series. If you'd like more information about the Hub, or you'd like to stay updated about future talks we might be having or activities we are doing, please visit our website, and you can see the link in the chat. I'd like to begin with a land acknowledgement. And so we'll be acknowledging the Indigenous peoples of all the lands that we are on today. So while this is a virtual platform, I ask that you join me in taking a moment to acknowledge that this land continues to be home to diverse Indigenous peoples, First Nations, Métis, and Inuit, whom we recognize as contemporary stewards of the land and vital contributors of our society. A few quick housekeeping items before we get going. Please note that this session will be recorded. And following the introduction, you'll hear from our speakers for about 40 minutes, after which there will be 15 minutes or so of question and answers. If you would like to ask our speakers any questions, please enter your questions in the Q&A box or raise your hand, and you can do that by clicking on the reactions symbol at the bottom and then clicking raise your hand, and we'll call on you. We kindly ask that you keep yourselves muted during today's session unless called upon to ask a question. So with that, I will invite our Hub Director, Dr. Jane Thornton, to introduce our speaker, Dawn.
Hi, everyone. Thanks very much. I'll look here. Welcome so much to your session. I'm so thrilled to have everyone here today. It means a ton for us. So from a perspective of, you've heard a little bit more about kind of our activities. We're just thrilled in terms of the research direction that we've taken with our interdisciplinary initiative and our research hub is really to, from the beginning, from the initial part, whenever we do our research, is really co-producing with the people where the research will affect the most. So in terms of community members, patient partners, and we're all patients at one point or another. So we really, it really resonates with us, the feedback. It changes our research directions and our aims throughout. So we're really thrilled to be able to have you included here today and to learn from Dawn Richards, who's an unbelievable patient advocate and inspirational role model for all of us. And so we're thrilled that she's able to join and help us all understand more about patient in terms of research grants and how it looks like to review a grant from start to finish when you haven't necessarily had that introduction before. So Dr. Dawn Richards, she lives with rheumatoid arthritis and osteoarthritis. Now, she didn't put doctor in her bio, but she does have a PhD. Her work combines her analytical chemistry training and her passion to ensure patients-informed research in healthcare. And so she helps people and organizations design and execute their patient engagement initiatives. And so the Western Research Hub for Physical Activity and Health began working closely with Dawn in 2021. And she helped us establish our Community Advisory Council, gave us incredible insights on how to do that, and continues to collaborate with us in our pursuit to engage athletes and patients in sport and physical activity research and policy. So thanks again, Dawn, for helping us all here out today, and look forward to questions and insights that come up through the session. Thanks, everyone.
Okay, thanks a lot, Jane, and thanks, Kristen, for setting the stage for us. So as Jane and Kristen indicated, it's really my pleasure to be here to talk to you today, kind of like a 101 about grant reviews and the basics of peer reviewing grant applications, mostly through the perspective of being a patient partner. For those of you who are still using Twitter, I'm still there and very active. Feel free to share anything from this session. You know that it's being recorded as well. And if you have questions that you think of throughout the session, please go ahead and just pop them into the Q&A. We will have time for a discussion at the end. I can't guarantee we can get to all of your questions, but go ahead and put them in there, and we'll try and get to as many as we can. So today, the objectives really are to just give you a basic overview of the process of peer review of grant applications. So how it works and how you might approach it as a patient partner. To help you become familiar with some of the terms related to grant applications and peer review as well. This is another thing in science where we like to use lots of terms. And so we want to help you become familiar with those before you go into any of these situations. And we've got a couple of great patient partners here today, Catherine and Kirk, who I've had the pleasure of working with through Dr. Thornton's work. And we're going to learn from them about some of their experiences with respect to peer review and grant applications. So Jane teed this up nicely. You might be thinking, yeah, cool, but like, why are you here talking to me about this? So a little bit about me. I kind of have my foot in both camps as a researcher and as a patient partner. So as Jane indicated, I'm actually an analytical chemist by training. So I come from a really basic science background. I do live with rheumatoid arthritis. I was diagnosed nearly 20 years ago, and more recently in the pandemic with osteoarthritis. And yes, I do take all of that into account when I help people and organizations work together with patients as partners in their research projects or initiatives or otherwise. So let's start with what is peer review of grant applications. So a grant application is something that is written by a researcher or a group of researchers when they're asking for basically money to fund a proposed research project. So in Canada, typically researchers' salaries are paid by the institution that they work for, but most of their funding for running their lab comes from outside sources. Now, some of it might come from the university, but often a great deal of it comes through grants they've derived from maybe agencies like the Canadian Institutes of Health Research, the Natural Sciences and Engineering Research Council, or NSERC, or maybe SSHRC, the Social Sciences Research Council. Those are called the tri-agencies, in case you're interested. Those are the federal funding agencies in Canada, but it might be from a health charity, it might be from a SPORE support unit, a strategy for patient-oriented research support unit, might be from a foundation. There are lots of different organizations that provide funding to researchers to help them carry out their fundamental research. And so what does peer review as part of those grant applications look like? Well, peer review is a process that's used to review these applications that have been submitted for funding. And what happens is that the applications that researchers submit are assigned to reviewers, and those reviewers will have the required experience or expertise, and that might be at an individual level, or it might be at a collective level altogether. They've got the experience and expertise so that they can assess these grant applications, and they'll assess them based on specific objectives that the agency or the organization sets out, along with specific evaluation criteria that the organization or agency also set out. So, based on what the funding call is, there will be different specific objectives for it. There will be potentially a different set of evaluation criteria, et cetera. And it will just be dependent on the organization and what this funding call looks like. Now, traditionally, reviewers have mostly been academics in peer review of grant applications, but we've really seen in, I'd say, the past decade, the past 2 decades, that there are more and more non-academics that are participating in these peer reviews as well. And they might be patient partners, they might be community members or care partners, they might be individuals from industry, so maybe pharma, biotech, the medical device industry, might be government representatives. Now, they wouldn't be from the same agency that is supporting the funding call, but there could be people from Health Canada, from the Public Health Agency of Canada, et cetera, who have skills and expertise that would allow them to participate in these as well. Peer review is also used in publications when people submit manuscripts that they want to have published. But we're going to hold off on talking about that. We're going to focus our conversation here on the grant application process. So those are some basics. This is why people write grant applications, to get funding. And peer review is part of an objective process to identify which of those applications should actually be funded. So let's go over this whole process a little bit more. And I put in the title that this is what it looks like generally. These are kind of like the basic steps for the process within any organization that hosts a funding opportunity for researchers to apply to. But the specifics are going to look a bit different depending on the organization. So we're looking at this generally. If you do participate in any peer review of grant applications, you should be provided some good instructions at the start, understand what your role and responsibilities are, and that will help guide you through this process that we're going to talk about in general. So to start off with, peer reviewers are assigned applications. And again, that's based on knowing what their expertise and experience and skill set is. The organization will make a call about who will be assigned what applications. The number of applications that you might be assigned can really vary, and it's going to depend on how many reviewers there are, how many applications are received. So that would be something you might ask a question about. Sometimes not only patient partners, but other reviewers are provided with compensation for doing this. And again, that might be another question that you ask when you get started. So you're assigned applications up front. In another slide, I'm going to talk about this concept of conflict of interest. And even though you've been assigned an application, if you're at conflict with a person, a team member, et cetera, within that application, then you would not be assigned that application, but we're going to come back and talk about that. And then there's generally a period of time between when you're assigned your application, so you're kind of given your workload, and when you participate in the peer review meeting. And again, that's something you probably want to ask about before you commit to something, is get a sense of how much time you might need to review the applications you've been assigned, and what's the time frame between when you're receiving those applications and when you participate in the actual peer review meeting. So let's continue in the process. You've been assigned applications, and next what you're going to do is read them and go through them. You're going to score them based on the rubric that you're provided, right? What are the objectives of that funding call? And do you feel like this application meets that objectives? You do an evaluation based on whatever scoring mechanism the organization is using, and they would provide you guidance on the scoring mechanism that you would be using. And you would also write down comments for each of the applications that you review. We're going to come back to this a bit later too, but I really encourage you to think about, when you're writing your comments, to think about being the person reading those comments on the other side. So you want to make those comments helpful for them, to help them understand, why you're scoring something the way that you are, questions that maybe the application brought up for you or that were unanswered for you. If you thought like the timeline didn't seem realistic, if you felt the budget wasn't realistic, it's really important for you, as much as you can, to explain those things. And that really helps the applicant, when they receive your comments, understand why you've evaluated something the way that you have, and maybe more importantly, how they might actually improve upon that the next time that they write an application, whether it be for the same project or a different one. So you've read all the applications, you've scored them, you've got your initial comments down. Often you will submit your scores and comments to the organization in advance of the meeting. Important to know that there's always opportunity, or there should always be opportunity for you to change those scores and change those comments based on the conversation that you participate in at the peer review meeting. So right now you're kind of in your own bubble. You've read the application, you've scored it how you feel is appropriate given your knowledge and your expertise, and you've written comments that reflect that. But when you get to the peer review meeting, you might decide to change those things a little bit based on the discussions that you'll have there. So submitting the scores and the comments just really helps the organization get a grasp on and prepare for the logistics of the meeting. They get an idea of what might be applications that people are agreeing on overall. So maybe there won't be a lot of conversation on that application. Things where the reviewers are really diverging in terms of their opinions. So they might know that that's going to be something we'll probably have more of a conversation about, etc. So while you will submit your scores, they will likely change, or they can change based on your discussion. And then you'll participate in the peer review meeting. And this may be virtual or it may be an in-person meeting. It depends what it looks like. There will be a chair at the meeting, and the chair basically runs the meeting. They keep things on time. They explain how the meeting will work. Sometimes when patient partners are involved in peer review meetings, the chair will meet with them in advance and go over that, especially if you're new to the process. That might be really helpful for you. So they'll explain how things work in the meeting. They'll make sure that people declare conflicts at the start of conversations about each application, and they'll keep things on time. So they're kind of the person that runs the meeting. And usually at peer review meetings, there's at least a person who's assigned as the first reviewer, and that individual will be the person that kind of sets the stage for the discussion around that application. So they'll give a bit of a synopsis, and then they'll go through their review, what they thought were particular strengths of the application, what they thought were weaknesses or challenges. They'll share their score. And then there may be a second reviewer, and sometimes that's a patient partner who will be the next person that will talk. And then usually it's kind of opened up to the other people that were assigned that application. And sometimes, even though you weren't assigned to an application, you might have access to all of the applications that have been submitted, and you might want to participate in conversations around particular applications. The goal at the peer review meeting is to basically agree on scores for each of the applications, and to basically come out of the meeting with recommendations being made for what the rank of things look like, and potentially what should be funded within that allotted group of applications. Also important to know that sometimes not all of the applications will be talked about at the peer review meeting. So they might be what's called triaged. If the peer review committee feels like particular applications did not meet criteria to be discussed, or the scores were in agreement that they were very low, they might not even be talked about. And that's called triage, where they're not discussed, and then the rest of the time is devoted to the more competitive applications that were part of things. So usually the peer reviewers don't decide which applications are actually funded. That's usually something that the organization hosting the funding call decides. That might be based on budget, that might be based on strategy, it might be based on other things. Generally, how the peer reviewers score things stays the same in terms of where it goes for funding recommendations, and things are rubber stamped from there. But again, budget and strategy can come into play for organizations in terms of what's ultimately funded from that group of applications. So going back to applicants from the organization that's hosting the peer review, might be verbatim comments that you have provided as a peer reviewer, or they might be consolidated comments, not your verbatim comments. That's maybe something you might be interested in asking about. The applicants are usually told their score and where they ranked out of all the applications that were received. And you as a peer reviewer may be asked about your experiences in the process. And even if you're not formally asked that, you should feel very comfortable with providing feedback about your process. Was it clear to you, what the process was? Was the peer review meeting easy to participate in? Whatever else you'd like to give for feedback, that's all welcome to an organization that is, trying to do their best with a number of peer reviewers and make sure that that's a good experience for them, as well as the applicants whose applications they're reviewing. So that's kind of a general overview of what to expect or what happens with peer review of grant applications. We're going to look at some of the terms and principles, and I've already mentioned this concept of conflict of interest. And so conflict of interest can be real or it can be perceived. It doesn't really matter which one it is, it's still a conflict of interest. And that's when it's seen that your interests, engagements, or relationships appear to compete or conflict with your responsibilities as a peer reviewer. And this could, reflect poorly on you if a conflict of interest is not declared. So I'll be really clear with a couple of examples. One example could be that you've been assigned an application to review, and you have in the past worked really closely with the person who has submitted the application. You're not on the application, but you have been, closely involved with the team, and you've got a relationship there. And so the organization that's assigned you as a peer reviewer may not necessarily know that. And so you would declare that you have a conflict of interest with the applicant team because you've worked with them closely in the past. And then you wouldn't review that particular application. And in fact, when you would go into the peer review meeting, you would likely be physically removed from the conversation. So if it's virtual, you would either be asked to leave the meeting for a bit, or maybe you'd go into a breakout room while that conversation occurred. If it's in person, you would physically leave the meeting while that discussion is taking place. So that's one example of a conflict of interest. Another, conflict could be that you are part of an application that's been submitted to the overall competition for which you are a peer reviewer. And you might be part of a team, so you haven't been assigned to review that application, but again, you would declare a conflict when the conversation about that particular application is happening. And again, you would be removed from any of the conversations related to that. So those are a couple of examples of conflict of interest. It could be other things too, right? That, I don't know, if you're a patient partner, it's actually your physician who has submitted the grant application. You're clearly at a conflict, even though they treat you and you might not be involved in their research. Or maybe you are a research participant in someone's application that's being reviewed. So you're not a patient partner on it, but you participate in their research, their research, those types of things. So conflict of interest is important, and all you have to do is declare it, either at the beginning of things when you're assigned applications, you would declare your conflict and you wouldn't look at those applications, or in the discussion at the peer review meeting itself, you would declare those conflicts, and then you wouldn't participate in any of those discussions at all. Some other terms, everything around the actual peer review meeting, including all the materials and all the discussions, are considered confidential. So you can think about kind of this cone of silence around you with respect to the whole peer review process. The process itself wouldn't be secret, like this is generally how it happens, but any details related to specifics around what's being evaluated and looked at would be considered confidential. So you shouldn't be sharing any of those materials physically via email or in discussions. As a patient partner, you might find it helpful to talk with other patient partners in advance of the peer review meeting. And maybe you've got questions about specific grants. Again, I would just be really cautious about that, and I would ask the contact that you have at the organization about whether you can do that or not. They may or may not think that that's okay to be happening, and so I would get clarification on that. The last thing, which I've kind of talked about, but I haven't been specific about it, and that's this concept of being constructive, that peer review, whether it's for grant applications or whether it's publications, is really intended to be constructive. And it's intended to help contribute to making the research approach stronger, make it more robust, and ultimately improve the outputs and the outcomes of the research. And so as much as possible, it's okay to not agree with what they're proposing or to see weaknesses in it or things that should be improved. But being constructive and being really transparent about why you feel that that's the case can only help the applicant who has submitted their application. And it's really important for you to explain yourself. There's nothing worse than receiving, comments back from peer review where people haven't explained themselves well, and they've just given you a bad score, but they haven't told you why they've scored it that way. So think about it from that way. How can you best help the applicant with your comments and with your thoughts? Some other terms that you might see in the actual applications themselves with respect to the folks doing the work, the principal investigator or principal applicant, or sometimes they're called nominated principal applicant, those are the people that basically are leading the work itself. So they're in charge of everything. They would hold the grant at their institution. Co-investigators or co-applicants would also be people that are kind of part of the leadership team, but they would be directing specific parts of the proposed research. A trainee is an individual who is working on the proposed research as part of their training. So maybe they're working on a postgraduate degree, or maybe they're working on a fellowship, and they're part of the team conducting the work. A collaborator is usually someone who is not as involved as some of the others on the application, and they're there generally for a really specific skill or part of expertise that they bring to the application. And then sometimes you'll see the acronym HQP, which stands for highly qualified personnel, and that really refers to anyone who's doing the work. They've got a lot of education and a lot of credentials in terms of doing the work, and that can include patient partners who are part of the applicant team as well. They bring their own skills and expertise. Other terms that you might hear as well, sex and gender are important, and they're being asked to be explained within research a lot more than they have in the past. Sex is whether an animal or a person is biologically male or female, and gender is a sociocultural construction of how someone views their role in society. So that might be a man, woman, might be a trans woman, a trans man. There can be other terms for gender. And sex and gender are important considerations. If we don't take into account, for example, how a specific medicine impacts males versus females, we only look at males. I'm just going to take a stab at it. Then we only know how it works in males. It might work differently in females. And it would be important for researchers to justify why they're only looking at things with respect to one sex or one specific gender. And equity, diversity, and inclusion, sometimes you'll hear it referred to as EDI. And these are really values to ensure either a diversity to the research team itself, or maybe to the participants in the research. So you might be asked to look at it through either lens. And it might be about ensuring that the team is diverse, that there are ways for different individuals to be involved in the team itself, or it might be as participants, and it might be about understanding how the team will address specific challenges or potential barriers to certain populations or certain ethnic groups being part of the research itself. So just a couple of things for you to think about. Let's switch gears a little bit. Let's spend a few minutes talking about how you might actually approach this if you are a patient partner peer reviewer. So these are just based on some of my experiences. You can take them for what they're worth, and they're not inclusive. So there's going to be lots of stuff that's not here. We're just kind of doing a general overview. But, you know, getting started. So where do you start with things? You should be provided with instructions for reviewers. So as a reviewer, you would, you know, go through that and see what you're provided. I find it helpful too to look at the instructions for applicants. They should kind of mirror each other, but, you know, take a look at them. And then I usually just look at the application form itself. So what have I got myself into? Is it 5 pages of a research plan? Is it 10 pages? Is it 15 pages plus a whole bunch of other stuff? That just gives me a sense of what I'm in for. I'd encourage you to ask any and all questions if you're at all unclear about process or expectations. There are no stupid questions. This is often very new to many people, including people in the research community. So don't feel intimidated by it, but also understand really clearly what your part is in it. I find it helpful if you can, and I know this is hard because time is precious, but I find it helpful to read all assigned applications together. I know what my mood is. I can get in the groove about going through things. Usually the first application I read, I start to set like what the scoring looks like, but sometimes as I go through all of them, things change because I read other things and I'll think, I thought that first one was really good, but actually it's not as good as the third one I read, right? So you'll start like adjusting things as you read, and I just find it's a bit easier if you can find the time to do it all together. If there's a summary, a lay summary, or plain language summary, I find it helpful to read that first. That also helps me know what's kind of the breadth of the applications I'm looking at, which ones are going to probably take me more time to review just based on what that looks like. And I just, instead of jumping into like a full application, I just find that kind of biting off digestible pieces at the start is really helpful. So again, these are from some of the things that I've learned both as a reviewer as well as someone who helps write grant applications. What does a well-written application look like? It should be clear to you, right? It should be, you should be able to follow a story, and I look at applications as stories. This person is weaving a story for you to walk through, and you should be able to understand that story right from the start when they explain what the problem is, why their proposed research is important, and what gap this fills in the current science or evidence or knowledge. So why should we fund what they have proposed? I know lots of people that just like to write and write and write and use up all those pages of space. But for me, I find that white space and some graphics can be really helpful in communicating things, or tables can be helpful as well. Really important that they address all sections that are required and each point that's required within those sections. If they have clear headings, that makes it a lot simpler, especially if those headings jive with what's in your reviewer manual or what's provided to them as applicants. And then their ideas are well explained and their sections are well written, and they don't leave you asking more questions. In fact, a good application for me is one where I start off with questions, but as I go through the application, those questions start to get answered for me. And you know, things come full circle. Some other things. Does it appear doable or realistic? It's often called feasible in the time frame proposed. So let's say they're proposing that within 1 year, they're going to build a rocket ship. I don't know, does that seem feasible? Maybe it is with the team that they put together. Or maybe they're going to build a small part of the rocket ship in the year, and that seems more feasible. You should be able to judge that. And you should also be able to judge the budget, if they've justified it well and it seems reasonable, or do they seem to be padding it and putting in things that you don't really feel are necessary? They should really clearly explain what the deliverables and the outputs will be. So, maybe they're building an instrument. Maybe they are going to, with that, write a paper. They have other ideas for work that's going to come down the line from that. They expect to present at a conference or two. They expect to do a few webinars. They should really clearly describe the team members, who they are, their roles, their expertise. And if they have what's called letters of support, those are going to be from people or organizations that play a role in the application. And those should be really aligned with what you're reading in the grant. So what is that person or organization proposed to do? What expertise are they bringing? What parts will they be involved in? And like I said, that should match with the application. Okay, so I'm coming to the end of this first part. Hopefully I've shown you that peer review of grant applications it's a structured process for experts, including patient partners, to provide input and constructive comments to grant applicants. And patient partners can bring valuable complementary perspectives to peer review of grant applications. I've seen it before. Patient partners being at the table change what the dynamics look like. They change the conversation that happens. You bring different questions than your scientific or medical counterparts. And all of those are just as important as what the other peer reviewers bring to the table. So as I mentioned early on, I'm going to ask Catherine and Kirk to join me. They each have about 5 minutes to talk a little bit about their experiences with peer reviewing grant applications. And we've asked them to specifically share some of the things they were unsure of when they started, give you a few nuggets of advice, and talk to you about like what's in it for them, why they do this and why they enjoy it. So I'm going to stop sharing slides for a few moments and ask Catherine and Kirk to come on. Okay, so Catherine, I think I'm going to pass it off to you first. So would you like to go for it?
I shall. Thank you, Dawn. I will just say that the lawn maintenance people have picked a particularly inopportune time to be mowing the lawn right in front of my office window. So if they come back again and it's noisy, I do apologize. Anyways,
No problem.
Great presentation, Dawn. It's no matter how many times you reviewed a grant, it's always helpful to get some pointers again. And I'm just happy to be here today to just share a few thoughts. We were given 3 prompts of questions. First was, what was the one thing you were really unsure of the first time? And I would say expectations. What is really my role here? Am I supposed to be looking up terms I don't understand in the grant application? Am I supposed to be reading the literature that has been cited? Am I expected to comment on methodological things that are beyond, my area of expertise? The answer to all of those questions is no. But as a patient, especially the first time, you want to do a good job. You're feeling uncomfortable in this space, but you're there to bring the lived and living experience perspective. There are other people at the table that can bring all the other perspectives. So, and also just ask for clarity about what is expected of your role. Just very, how do you submit your reviews? Are you expected time-wise, how much to spend, those types of things. So just clarity and ask questions. My 2 pieces of advice would be, one just flows from the other. Don't worry that you don't have the expertise that the others do. Just feel confident in what you bring to the table. The other is to, and maybe this is just something that I struggle with, but is to try to set a time limit, how much time you're going to spend on the reviews. That might be framed in part by the compensation, if there's a maximum of this many hours, but I know for myself, it's easy to get so wrapped up and so involved that this can, take over, many hours more than it really should. And once, I'm kind of embarrassed to admit, but I was like reviewing grants while I was in the Bahamas, which somehow just seems wrong, right? But so just, schedule your time and don't overcommit. What do I get out of this? I was a participant in a phase 1 clinical trial and then numerous research studies after that. And I found they were almost all very researcher centered and not patient centered. So this is one way of bringing my perspective, the patient perspective, to how research happens, and to advocate for patient priorities. And when you're in a review session and you have that moment when your comments and feedback have kind of changed the dynamic of the conversation, it's a really affirming feeling when you know that your presence is making a difference. It's also really awesome when you see, this might be years down the road after you've reviewed a grant application, but if it's funded and then they publish their results, that I really enjoy that dynamic. And the last thing is, it gave me an opportunity to develop new skills. And that has led to being invited to be on research teams and to co-write grant applications, which again is an opportunity to advocate for things that matter to patients, relevance and meaningful research. And for me, it's also led to a career change. In that I've taken some of these skills and I now work as a research officer, where I spend most of my time advising faculty on writing grant applications and also sometimes reviewing them as part of my paid employment. So I will leave it there.
Awesome. Thanks, Catherine. And just a reminder to people, if you've got questions for Catherine or Kirk, please put them in the Q&A and we'll come to them after Kirk shares his experiences. So Kirk, over to you for a few minutes. Oh, Kirk, we're not hearing you. No, I can't hear you. Can others hear Kirk? No.
Perhaps you can try rejoining the audio. It's a microphone button on the lower left corner. It says mute. If you click it, there are some options to join the audio.
Darn it, we can't hear you still, Kirk. I'm wondering, Kirk, if you're okay to leave the meeting and come back in, we can maybe take a question or two and then you can come back in.
Yep, that's a great idea, Dawn. Thank you. There is one question that's in the Q&A box from John. It says, highly divergent reviewer scores can have a significant impact on final rankings. What advice can you give to a patient partner reviewer whose scores are different from those of the rest of the review panel?
Catherine, would you like to take a go at that, or would you like me to?
I'll just say a couple words and then hand it over to you.
Sure.
If you're giving your honest feedback, then I would stick with that. And if you're asked, explain very clearly why you have given your ratings that way.
Yeah, I think I'm very aligned with you, Catherine. I think sometimes you may come into peer review with very different scores from the other reviewers. You may learn through the discussions that you feel like you should change your scores, and I think that's perfectly fine. I talked about that before, that you've got the opportunity based on the discussion that's happening to change your scores. So maybe talking amongst yourselves with the other reviewers does change your perspective, but otherwise I feel like Catherine that, you know, if you explain your scores and potentially why they are so different from the others, hopefully that leads to a discussion where the rest of the peer review panel understands why that's the case. And I've seen that change scores as well. So it's not always about patient partners, you know, changing their scores. It might be others on the peer review panel changing scores as well. I see Jeanette Smith's hand up. Kristen, are we able to unmute Jeanette?
Yep, she should be able to
Okay.
unmute herself. Jeanette, go ahead.
Okay, suddenly I don't hear Jeanette.
I can't hear her either. She's unmuted, but I can't hear her, unfortunately.
Okay, so we'll see if Jeanette comes back. And I've also seen in the Q&A about the slides being available. So I think, yeah, I think that we can do that, Kristen. We could create a PDF version of the slides and share that out with the recording as well.
Wonderful, thank you. I had some other questions here while we wait to see if Kirk's able to get back in the room. I would be interested in both of your perspectives on this. I'm wondering, you know, obviously there are topics of research that come up that are maybe more interesting to you, or just the writing style you like, that sort of thing. So all these little biases that we have when we are reading articles or applications and that sort of thing. And so I'm wondering if you actively have any practices that you do to manage your own biases, or, you know, acknowledge them as you're preparing to read an application.
Good question, Kristen. Catherine, oh, we'll just go to you, Catherine, if you've got some thoughts there before we go to Kurt.
I'll just say briefly that I've noticed that writing that is very similar to my own, I tend to appreciate more. So if I'm reading something and I'm going, oh, I really like how this is written, then I do a check. Is this because it's how I would write?
Yeah, I think that's a really good point, Catherine. I think I'm very similar to that. I think part of why I think it's important to also try and look at things all at the same time is I find that's also an easy way for me to keep things, I think, more objective and in check, is that if I'm reading everything at once and looking at everything all together, then I can come back and see if I was really fair in how I've scored specific things, or to Catherine's point, if I've gravitated towards something because it was written in a style that I appreciate more than some of the others. Okay, Kirk, we see you're back. We hope that your sound works this time. I think it does, Kirk.
Coming through okay. Oh,
Yes.
great, thanks. Well, thank you for your presentation, Don. It was very concise, and I liked a lot of what you said. It was on my mind anyway. But to get to the 3 questions right away. First of all, I guess my biggest fear was, and Catherine said, whether I'd be qualified enough or have the skills to do what was asked of me. But then I thought, well, I'm bringing life skills and my years of education and prior years to that in the legal field to the table, and just the general world of experience. So I do have a voice and I do have something to offer. So that was the first thing that I was worried about. Secondly, the expectations of doing my job for them. But I found with whoever you're working for or volunteering for to read grant proposals, make sure, as you said, that they did spell out what is required. if you had a good guide sheet for the marketing and those things, that they have all that. And you have some type of orientation session, which I highly recommend that you sit through, take notes. Don't be afraid to ask questions as you proceed. I know I did the very first time I was involved with one, reading grants. But for myself, giving advice to someone doing this, you have to approach it the way you may approach any other type of job. For myself, like what you had said, Don, I don't read them all at once. I did approach reading these, so I'm reading the newspaper. There's a story to be told. Because they tell me everything I want to know when I read the paper. Sometimes it's like reading the editorial. If the editorial doesn't come across, you're not going to enjoy it. So I approach it that way. And so I read everything within a time limit that I set myself. And then I put them note down. I don't look at anything for a day or two. If the time permits it again, you have to look at your schedule. When I do decide it's grading time, I review the grade sheet again. And then I color code everything. It's just my way of doing things. I go through and read them all in one day. So I set aside a day. And so if it's only 3 to 4 to be read, I get a day. If there's 8 or 9 or more, then I have to do it over a couple of days. And I go through and color code and everything. So I mark at the end of the read sheet one that I've read, mark, do my marking, and make some general comments on the side. So when I go to finalize my marking sheet, and that's when I'll finalize my comments and I'll look at everything is not bad. All I read them all. Sometimes I'll find the first one I thought was fantastic. Really, it's not as good as the other 3 or 4 or whatever. But I went and budget your time and, work according to what you would do it and doing this as a job, I guess. And you have guidelines and follow the best you can. Everyone is different. I approach it again, as I say. So I'm reading a paper or I'm bringing my work experience in the world of education, marketing exams to students. Sometimes I would mark them twice because I find out that I was too hard on them and realize I gotta take another second look at things. What I get out of this is developing skill, fine-tuning my own skills when it comes to grant review, and becoming more effective in my way I mark these things. Starting to realize that, I'm not a researcher, never have been, but, as a patient, I want them to at least have a good outcome. So if they can prepare a proper methodology, how they going to get the outcome? And that everything is going to be cured overnight through research, but it would be some type of outcome from this. So I look at that as well. But to me, it's giving back to the community at large. The doctor's been very good at treating me for the illnesses, etc. over here. But it's giving back to the community and giving back, I can write checks, but at least I can do some work, which I think is beneficial. Developing my skills so that I'm not afraid to stick my hand up, saying, yeah, I'm prepared to help you out in some way or another. And it's led to that for me. That's about all I could say right now without going on for a couple of hours.
Thanks, Kirk. I'm really glad that you were able to come back on and share those experiences. We've got a few minutes left here, and I see one comment and a question. So Jeanette was having technical difficulty with her sound. So thanks for typing in just your comment there, Jeanette, that you have only reviewed lay summaries. So it's not out of the realm of possibility that your scores would be different from others. And that's one thing that we didn't talk too much about. Sometimes patient partners are asked to review all aspects of the grant, take a look at everything, and sometimes they're asked to look at specific sections and focus more on those sections. So thanks for sharing that experience, Jeanette. And then the other question we've got is from Donna Rubenstein. So Donna is asking for guidance. How might a patient partner handle the situation where they feel the criteria or guidelines that are provided are not adequate? So for example, reviewing patient engagement and plans of a grant where we feel the guidelines provided could be improved and reviewer questions are too limited or narrow. So maybe I'll ask Catherine or Kirk if you've got any comments there based on maybe your own experiences or just thoughts to provide Donna with some advice. Kirk, it looks like you've got some thoughts.
Well, I would say that the organization should be debriefing you after the whole process is over. And you should be prepared to offer feedback. I think the organizations that I've done this for, they were more than willing to accept the feedback of a patient. I would, you know, I'm not one to know that when my questions thoughts, if you don't like it, fire me, I won't come back. But I think you have to be prepared to say, hey, you know, just an FYI, I found that this didn't go far enough, or you're not asking a proper question, or is that you're leaving it too wide open for interpretation or whatever. So I think you have to be prepared to, you know, to offer feedback to the media, regardless of what you think is going to happen. And let them know that there's room for improvement. After all, no one's perfect. Even the organizations can't be perfect in setting their guidelines on an application. So yeah, it's the old world has everyone benefits by talking to each other.
Thanks, Kurt. Anything additional from you, Catherine?
I'll just add that sometimes on the review forms, there is space for additional comments. And that would definitely be an opportunity to indicate that you have some reservations about the process and the questions asked.
Yeah, I think also, you know, that could be a real area where patient partners, I'll say, can bring great expertise to the review. And it's commenting about that type of plan that someone's asked to put together and to help the other peer reviewers understand why you think, you know, the guidelines around it or why the instructions for reviewing that part of it should be changed or made better, etc. Just a comment in the Q&A that just reviewing the lay abstract doesn't really sound like engaging patient partners. And I'd have to agree with that. I think that some organizations are just learning about including patient partners in what they do. And so, you know, it's a first step. I'm not going to make excuses for them, but in the past, we've seen some of those things happen and then move on and evolve to greater engagement, so to speak. And then we'll just wrap up. I think Paula's got a quick comment too, that every time we review grants at Lawson, they ask us questions about the review process to improve it. And I think that's made our process much better defined, and the evaluation forms are really good. We only review the lay summaries, and so we need to be able to understand them and give them a good review. It's training researchers and established reviewers to write better lay reviews. So thanks for adding that, Paula. I know we're at time, so I do want to thank Catherine and Kirk for joining me here. And I'll just ask Kristen if you would like to close things out, Kristen.
Yes, thank you so much, Dawn, Catherine, and Kirk. We really appreciate you sharing your experiences with us. And to all of you in attendance, thank you for being here and taking the time out of your day to join us. Dawn, I was just wondering if you wanted to put up your last slide that had your contact info on it, so people can write that down. A reminder that we will be sharing a link to the recording of the session in the coming days, as well as Dawn's slides in PDF version. Thank you, Dawn, for agreeing to share those. Finally, if you'd like to learn more about the Western Research Hub for Physical Activity or Health and the work we're doing to make physical activity more accessible for people with chronic conditions, please see the links that Laura's putting in the chat. And if you have any questions, comments, or concerns about today's sessions, please reach out. Laura will also be putting my contact information in the chat. And maybe we'll circulate Dawn's contact info as well when we share those recordings and the slides.
I just put in the chat, Kristen, just so you know.
Amazing.
Yeah.
Okay,
Yeah.
thank you. So once again, thank you everyone for joining us. We appreciate you being here. Thanks to our speakers and have a wonderful day.